Can you talk to a little bit about some of the treatment decisions that get made in a PERT and some of the subtleties that get involved in this very complex decision making?
Yeah, so I think you're exactly right. Someone comes in with a low risk PE, they're going to get anticoagulation. That's not rocket science. Someone comes in and they are hemodynamically unstable and they have a massive PE. You need to do some kind of intervention. You need to do it fast. It's that intermediate group where we really don't know. And if you look at all the guidelines, they say, well, consider an advanced therapy. And it's like, well, which patient should we consider that? And I think that is what is so rich and helpful about having a PERT, because you have multiple specialists coming together, kind of looking at each individual patient and thinking, okay, is this the person that needs advanced therapy? And I think that's what makes it so helpful. And I think, before we just looked at mortality because that was what we had, but now we really have to think about the longer term consequences, the morbidity associated with PE, CTEPH, pulmonary hypertension, even quality of life stuff. But I really think having the PERT team address specifically in real time what's happening with that patient and thinking about kind of not just the short-term consequences, but also the long-term consequences. And I think, within, as PERT teams came together and formed this PERT consortium, which is now international nonprofit organization, really whose goal is to influence and guide PE care. And as you know, one of the biggest accomplishments that we've done in the last 2 years has been creating this PE database. And that's now one of the largest, if not the largest PE database. And in just over 2 years, we have over 5,000 patient entries from 33 sites across the US. And now we're expanding it internationally. And I think to your question, what is so exciting about this is that institutions receive a dashboard of metrics with their own data against the national average. And it shows how they're doing as compared to the national average. And the power of this database is we can positively incentivize sites to get people to work together. And we've already seen changes in practice. And in addition, we now have a whole platform to start thinking about doing these clinical trials to look at various endpoints. So I think this is incredibly exciting.